understand that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan University students. I give my permission for this information gathering and physical assessment to be filmed and posted for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Hi, I'm Emily. I'm going to be your nurse today.
Hi, Emily.
What's your name?
I'm Jennifer.
Okay, Jennifer, what's going on with you today?
She's got this really bad headache that it will not go away. It's just this pounding headache.
Okay, and you just recently delivered your baby?
Yes, 2 weeks ago.
Okay, and it was a vaginal delivery?
Yes.
Okay, and who's your doctor?
Dr. Sloan.
Okay, Dr. Sloan. Were you was it a full-term pregnancy?
Yes.
Okay, no problems during the pregnancy?
No, right towards the end they started watching my blood pressures, but they said they were okay.
Oh, okay. How about any allergies, allergic to anything?
Yes, I'm allergic to penicillin and the trexazolam.
Okay, and how many times have you been pregnant?
2.
Okay. And you had a live birth last time too?
Yes.
And vaginal delivery?
Mm-hmm.
Okay.
Yes.
When was your last bowel movement?
2 days ago.
Okay. No problems with that?
No.
Okay. Do you wear glasses or contacts?
No.
Do you have any religious beliefs that we need to know about to better take care of you?
No.
Any cultural beliefs that we need to know about?
Mm-hmm.
Are you married?
Yes.
Okay. What's your husband's name?
Chris.
Chris. Do you smoke?
No.
Have you ever smoked?
Yes, a long time ago.
And how much did you smoke when you did smoke?
I smoked probably pack and a half a day. I quit like 14 years ago.
Okay. Do you drink alcohol right now?
No.
Any caffeine?
Very minimal.
Okay. No social drugs?
Mm-mm.
Okay. No herbal supplements?
No.
Do you take any like regular medications?
Just the postpartum stuff they gave me when I left the hospital, my Percocet and my Motrin. But those do nothing for my headache.
Haven't helped at all.
Pounds and pounds and pounds.
Okay. Did you have an epidural?
Yes, I did.
Okay. And no problems with that?
No.
Okay. Are you breast or bottle feeding?
Breast.
Breastfeeding.
Mm-hmm.
Okay. Did you have a tubal after delivery? Okay. And you said no complications with the pregnancy, so you weren't gestational diabetic or anything like that?
No.
Okay. Any like other neuro problems like blurry vision, dizziness?
Yeah, I've noticed like these almost like sparkly spot things in my vision. I just thought it was maybe I'm just too tired or from being up with the baby.
Right. And so this started after the headaches
Mm-hmm.
too. Okay. And you don't normally have migraines, seizures,
I
anything
haven't
like
had a
that?
migraine in a really long time, but this is not a migraine.
Okay. Not a migraine.
Yeah.
Any normal high blood pressure?
Mm-hmm.
Like, is that normal for you?
No.
Okay. Any other heart problems?
No.
Okay. What about no like type 2 diabetes or
No.
anything, thyroid issues?
No.
Okay. Any like shortness of breath or chest pain lately?
No.
Okay. Do you have asthma or any other
No.
lung problems?
Mm-mm.
Okay. Any infectious diseases that we need to know about, like a history of staph or?
No, the only thing I've had is chickenpox.
Okay. When you were a child, I
Mhm.
assume. Okay. Any urinary problems, like burning while you pee, frequent UTIs?
No.
Have you ever had an STD before? Have you ever had like an abnormal pap smear?
No.
So nothing
Mhm.
done to your cervix?
No.
Okay. Any stomach problems?
Yeah, well, IBS and a little acid reflux, but I'm not taking anything right now because I'm breastfeeding.
Okay. So no like Crohn's disease or
No.
anything like that?
Mm-mm.
Okay. Any muscle or skeletal problems?
No.
Arthritis, fractures? Okay. Any skin problems like rashes, lesions,
No.
bruising?
Mm-mm.
Okay. Any tattoos,
No.
piercings?
Just my ears.
One in each ear?
Yes.
Okay. Have you had any vaccinations lately?
Just my flu vaccine before I went home.
Okay, 2 weeks ago.
Mm-hmm.
Okay. Have you ever had surgery before?
Yes. I've had my wisdom teeth out, and I've had otoplasty and liposuction.
Okay. And those were all prior to pregnancy,
Yes.
I assume. Okay. How tall are you?
5'3" on a good day.
Okay. And how much do you weigh right now?
Do I have to tell you?
Yeah.
Okay, you're 141.
Okay. Any genetic disorders on your side of the family or your husband's side of the
Not that we
family?
know of.
Okay, and nothing so far with the baby, any problems with baby or your other child?
No, the pediatrician says they're perfect.
Okay, that's good. All right, well, on a scale from 0 to 10, how would you rate your headache right now?
Probably an 8.
An 8, okay. Any other, like, pain underneath your right breast?
Now that you mention it, I'm really tender right here. Feels like I got a bruise. I just thought it
Okay.
was maybe from pregnancy.
Right
maybe,
about here?
Maybe baby
Uh-huh.
was kicking.
Yeah, but it's still pretty sore even
it's
after.
very sore.
Okay. What about your bleeding? How's your bleeding been
It's
doing?
fine, just a little brown spotting.
Okay, so that's normal for being 2 weeks postpartum. I'm gonna look and see if you're swollen.
Okay.
And I'm gonna also check your reflexes.
Okay.
Looks like they're a little bit swollen. Were you swollen during pregnancy as well?
Towards the end, I got a little swollen, but nothing like this. This is very painful.
Yeah, they've definitely gotten worse after delivery.
Yes.
Okay. I'm also going to check your reflexes. Just try to relax. You have pretty brisk reflexes, which could also be a symptom of preeclampsia.
Okay.
With the headache and the tenderness underneath your right breast, those are also symptoms of preeclampsia. Your liver is affected with preeclampsia, and so that is why you might be feeling tender right here, because that's where your liver is. It also affects your kidneys, and that might be why you are more swollen now than you were before you had the baby. And it also affects your neurological system. That may be why you're seeing the spots. You have the headache and the brisk reflexes. I'm going to go ahead and check your blood pressure, listen to your lungs, and see if we have an increased blood pressure. If you do have an increased blood pressure, then I would assume that you probably have preeclampsia, but we don't know a definitive diagnosis until we get you back to lab work.
Okay.
And that will show your liver function, and that can tell us for sure if you definitely have the preeclampsia. Okay? Blood pressure is elevated. I heard 170 over 110.
Oh, wow.
Yeah, pretty substantial elevation. So I'm really leaning on the side that you probably have preeclampsia. I want to listen to your lungs and make sure they sound okay. You haven't been feeling like a fast heart rate or anything like that.
Okay.
Take a deep breath for me. And then listen to your belly real quick. You said your last time was 2 days ago?
Mm-hmm.
No vomiting or diarrhea?
Mm-hmm.
Okay. It's still real tender to touch right
Oh,
there.
yeah.
Okay,
Seriously.
sorry. All right, well, I'm going to go talk to the doctor and discuss your blood pressure. But what I can tell you and assume that you do have preeclampsia from your lab work that I'm going to draw, what we will probably do is give you a drug called magnesium sulfate, and it's going to go through your IV. It can make you feel kind of nauseous. You may vomit. We have meds that we can give you for that. It can make you feel really hot and almost sweaty. That usually gets better the lower the dosage that we give you after the bolus. but at first you may feel really sick, and that's normal. And magnesium will continue to infuse over about 24 hours. We'll keep it on you just to decrease your seizure threshold. While your blood pressure is so elevated, your risk for seizure is very high, and so we want to prevent you from having a seizure, and that's what the magnesium will do. Sometimes the magnesium just by itself will lower your blood pressure as well, but other times we'll have to give you some blood pressure medicine, maybe by mouth, maybe in the IV, just to control it a little bit better. And you may end up going home on some blood pressure medicine as well, until the preeclampsia completely resolves on its own.
Okay, so it will resolve.
Yes, it will resolve, and we will treat you with the magnesium, like I said. Do you have any questions about it?
What about breastfeeding? Can I still breastfeed?
You can absolutely still breastfeed. We definitely encourage that. You can use a pump while you're here at the hospital. We have hospital pumps that you can borrow. You just have to fill out a form that you're going to use our pump and treat it, with respect. Or you can still breastfeed if your husband wants to bring the baby in. We just encourage that someone else is in the room at all times with the baby, because magnesium can also make you very drowsy. So we don't want you to be by yourself with the baby and fall asleep or get sick and throw up or anything like that.
Okay.
Okay, any other questions?
I don't think so.
Okay, well, I'm going to go talk to the doctor and see what he has to say, okay?
Thank you.
You're welcome.